Good afternoon. This is Sayukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones do encounter at some point of time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to the chemicals present in certain food items, allergy to certain medication, insect sting, sunlight, and sometimes the causes even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic. But the most important part is not to ignore it, and doing self medication can actually worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria, its types, how we can prevent it, kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us Dr. Kiran Godse, Professor of Dermatology at Dr.D.Y.Patil Medical College and Hospital, Nerul, Navi Mumbai. A very warm welcome to you, Dr. Godse.
Namaste.
So today, doctor, we are going to talk about management of urticaria. And to begin with, I would first like to understand what is urticaria?
Right. So urticaria is red patches or hives on the body, which can come anytime suddenly. It can involve whole of the body. It can involve including the lips, nose, hands, feet, and almost you name a part and it can involve everything. And most dangerous is angioedema, where the swelling is on the lips or on the throat or in the tongue, where it could be serious that patient cannot breathe. So urticaria and angioedema are one of the commonest features are red hives and which are most itchy. One of the most itchiest condition on the skin is hives, and treatment involves long-term antihistamines.
Okay. And doctor, what are the causes? What causes urticaria?
Yeah, so as you know, urticaria is acute and chronic. Acute generally disappears in 4 to 6 weeks, and acute is typically if you eat, say, food prawns outside, you start itching. So typically, food items, colorants, preservatives, dyes, chemicals can cause. Some drugs like painkillers and antibiotics can cause. A viral infection or a COVID infection can cause urticaria, and change in place, change in weather, and stress also can precipitate urticaria. So typically, acute urticaria is a trigger is there. Suppose I eat something in the restaurant and I start getting itching. So typically, the food item or the colorants are the cause. Medicines and infections, they are the commonest causes. But this acute urticaria disappears in 1 to 2 weeks or maximum 4 weeks. You need to take antihistaminics and sometimes a short course of steroids. Problem comes when it becomes a chronic urticaria. So urticaria lasting beyond 6 weeks can go up to 10 years or 20 years. And this chronic urticaria treatment is long. And here the causes are different. The causes are autoimmune, that is, there are circulating autoantibodies in the body, or autoallergic, that is, allergy to allergy. And rarely we cannot find a cause that is known as idiopathic. So chronic urticaria affects 1% of the population. So huge of India's 135 crore population, almost 135 lakhs are patients who have this urticaria and which could be troublesome. So chronic urticaria is what patient comes to us often. Acute urticaria is often get treated by a family physician or in the emergency department of hospital. But urticaria staying for months and years together is most troublesome. Thank you.
Okay, doctor. And doctor, as you said, these are red rashes on the skin and they itch a lot. Now, the thing is that normally people who get any kind of skin allergies, normally a very common characteristics is that it itch a lot. Now, as a layman, if me or our viewers like to understand it, how does it looks like exactly so that, we can differentiate between urticaria and other skin allergies. Would you like to shed some more light on that, doctor?
Yeah, so urticaria is easy to diagnose. They are red, itchy wheels on the body. There could be a different shapes, size ranging from 1 to 10 centimeters. It can spread slowly on the body. And these red bumpy hives, you can feel it on the body. and which can spread. The moment you scratch, it will become more and more increasing, and it can involve whole of face and body. And one of the most troublesome is the itching, and most of the patients do diagnose that they have got hives or itch. The problem is in the treatment. So typically, any red, itchy bumps or hives on the body is urticaria.
All right. And you said many a times, especially when it leads to swelling of various parts of body, it could be more dangerous. We would like to understand, doctor, that is urticaria in itself is a serious condition.
Yeah, urticaria is serious in the sense it is intensely itching. Patient cannot stay long, can't eat, can't sleep. So obviously he needs a long treatment with antihistaminics. And when the itching involves the lips or throat, then he can have a difficulty in breathing. So such patient needs admission in an ICU or hospital where intravenous adrenaline, steroids, or any other medicines can be given to control the hives. So when there is a breathing difficulty, please go to hospital because there it could be something else.
Right. And that's what angioedema is all about,
Yeah.
right?
Yes.
Okay. And doctor, many times, because again, we know that, whenever something happens due to some allergy, we know that, all of us know certain anti-allergens. And in India, as over-the-counter medication is available, people just go buy an anti-allergent and, they get relief and that's it. So normally they don't go to the doctor initially. Now, what's your take on that? Is it okay to do, or we need to consult a doctor immediately?
Yeah. Now, obviously, if it's emergency medicine, you have to go to chemist and get the allergy medications. So the fexofenadine and bilastine, these are the commonest one which are available. Or Avail, Benadryl, these are the OTC drugs actually. Something these are drugs are OTC abroad. So obviously they can go to nearest chemist and get these medicines and start eating them because they are safe. But don't take steroids. Don't take steroids to control your urticaria. You need to take plain anti-allergic medications, which are generally safe. They are free from major side effects. Sometimes they can cause sedation, like I will in tablets you can get sedation or you can get sleepiness. So obviously you can find a local drugstore to get antihistamines and start eating and go to doctor to control the disease. But antihistaminics is a first line treatment, and then you can go and find it out from a shop and just start taking it one tablet twice a day and look for the response.
Right. And as you said, in chronic urticaria, the treatment is, lengthy generally, and it just goes on and on and on. And every patient, especially with chronic urticaria, they'll just come and ask that, is it going to get cured permanently? What's your answer on that, doctor?
Now remember, average urticaria patients, the urticaria can stay up to 3 to 5 years. That is the average lifespan. So, cure is a distant dream. What we can give is a good control of the disease. That is what we tell them. Cure will take time. We don't know when it got remission. Generally, urticaria patient go into remission on its own in 3 to 5 years. So till that time, you have to give medicine. So there is nothing like cure that I give something and urticaria goes away. That is not possible. But we have got very safe antihistamines medicines which can be given safely long term to control the disease.
Mm-hmm. And as again, you said that in acute urticaria, it could be mostly because of allergies, etc. In chronic, the causes may be different. Now, what is the line of treatment in both the cases? Do they differ, or what treatment options are available, doctor?
Yeah, so acute urticaria, you have to give antihistaminics. Typically, one tablet will not work, so 2 or 4 tablets are required, and sometimes a short course of steroid is required to control the acute urticaria. In chronic urticaria, typically main treatment is antihistaminics. Up to 4 tablets of antihistaminics we advise the patient to take, depending on the response, because one tablet of antihistaminics, say fexofenadine or bilastine, will control only 40% of the patient. So we give 2 to 4 tablets to this patient, which are very safe, which are available easily. They're not very costly, which will be able to control the disease. But the treatment is for months and years together. So gradually we try to adjust the dose. That is a dermatologist who is best to treat these patients. So they can adjust the dose according to response. So maybe we start with the 4 tablets, then after 2 to 3 months, we'll make it 2, after 2 to 4 months, again 1, depending on the body's response, we'll do the treatment. And remember, antihistaminics are very safe. They have got no major side effects. They do not damage liver or kidney. That is what patient's perception is. Only thing is, go to a doctor to find out what is the right dose for you, and you need to how long you need to take. Obviously, doctor will decide. Thank you.
Exactly. So going to the right doctor, meeting a qualified dermatologist is what we need, and definitely you'll get relief. Now, doctor, as you again said, because allergies are related, especially in the case of acute urticaria. Now, there are people who know that I'm allergic to eggs, or I'm allergic to seafood, or I'm allergic to pollen, or various other things. So I know what may trigger urticaria in me, so I'll take care of that, and I may avoid these things. But then there are people who never had any kind of allergies, and suddenly they start having, allergies from eggs or seafoods or whatever. Now, what do you suggest to these people? And then, first of all, how to find out that whatever is happening to me is due to some allergy which was not there before?
Well, it is most difficult to find what is exactly allergen typically. And as I told you, in chronic urticaria, true food allergy is less than 2%. So it is basically allergy in the body which is giving you trouble. It is not that food or environment is causing. Your body's immunity is gone haywire. So it is known as autoimmune urticaria or autoallergic urticaria. So typically, some food can trigger or worsen urticaria. So if you find, say, prawns is worsening my urticaria, don't eat prawns. That is the easiest way to tell you. But otherwise, it is a doctor's job to find out. So we'll do some basic tests to find out whether it is autoimmune or autoallergic. We may try to find out whether you have got sugar or thyroid or urine infection, because that is according to response. So a doctor will find out few basic tests to give you the best results. But again, we do not advise to do a prick test to find out what is the allergen, because that is not useful in urticaria. Because urticaria is typically a disease which is, we say it's allergy, but it's not allergy, it's an autoimmune or autoallergic disease. So doing a prick test will not help. So don't go for those allergy test panel or this thing, which will not help you anything. It just shows that your body is sensitized to XYZ, but the treatment lies with the dermatologist who can best to treat it with the safe medications.
Right. And doctor, many times patients complain that they their urticaria get worse during nights, or they are not able to sleep or rest because of the urticaria. What is the correlation? I mean, is there a correlation between urticaria getting worse during night, or what's the theory behind it?
Yeah, so typically all the allergies urticaria come after 5 p.m. or 6 p.m. And why it is so? Because our endogenous or body's own steroid production become less and less after 5 p.m. till 12. So that's why most of the allergies are there in the evenings and in the night, where our body's metabolism is come down and our steroid production in the body to fight the disease comes down. So most of the allergies come in the evening after 5 to 6 p.m. and go on till 12 or 2, and that is common, and it is because of our own body defense is little lower side as compared to daytime.
Okay. And doctor, many times people say that they get very tired or fatigued. So again, is this which comes with urticaria?
Yeah, see, the tiredness and fatigue is not due to urticaria, it is due to medications. Few of the medications can cause you sedation, drowsiness, and patient can't walk or work together. Disease per se will not give you sedation, but the medicine, yes. So that's why you have to choose a right medicines. And recently, we have got very good medicines available in Indian market like Gilastine, which does not give you sedation or drowsiness, and which you can take 1, 2, or 4 tablets as per doctor response. So olden times, we have got tablets which used to give a lot of sedation, but the newer generation antihistaminics are safe and can be taken effectively for longer time to control the disease without side effects like sedation.
Right. So it's always advisable to go and consult a doctor before taking any medicine, because they'll understand, they'll know what you need and what your, for example, many times what happens as we are not aware of it, we'll just go and buy a, anti-allergent or something which has a sedative property. And maybe my profession is such that that can actually be really, fatal or harmful. So please go consult your doctor. Don't go for over-the-counter medication. Don't do self-medication. Consult a qualified dermatologist in this case. And doctor, what are the potential complications of urticaria if left untreated?
Yeah, if you don't treat urticaria, it can worsen. Patient life become miserable. Patients may find it like suicidal tendency. They might feel frustration, depression, anxiety is often there. because they can't work. Just imagine I'm talking to you, I get swelling here, I start scratching, what will happen to me? So that kind of panic attacks patient get, and they really get depressed. So treatment is important. And remember, we have got the best medicine available, including the newer medications like biologics or omalizumab, which can actually control the root cause of the disease and give long-lasting relief. So don't think that only antihistaminics is the treatment. Apart from that, the biologics, which is known as omalizumab, which is available in India, can be given to control the disease. And then there are some immunosuppressants like cyclosporine and methotrexate can be given. But obviously, your dermatologist is trained to do this treatment, and you need to go this. So it is not that just give antihistaminics, if no response, there is nothing end to it. No, we have options available and we can control the disease. Obviously, cure comes after few to several years.
Right. And okay, we'll also take some of our viewers' questions. Suman Yadav is here, is asking, what is the best treatment of resistant chronic urticaria to antihistamines?
Yeah, so those patients who do not show response, we say that please take 4 tablets of antihistaminics, and still they do not get response. The best treatment is a biologic known as omalizumab, which is a little costly drug, but it gives long relief. Or you can have to go for anti-immunosuppressants like cyclosporine and methotrexate to control the disease. So remember, half of patients will get very good response with antihistaminic. Up to 50 to 70% patient will do well with antihistaminics. 10 to 20% patient will need something beyond antihistaminics, and then we have got effective medications available with us, which can be given without major side effects, and dermatologists know how to use them.
Okay. Advik Singh is asking, are there any dietary changes I should make to manage my chronic urticaria?
Now remember, diet has got no role in chronic urticaria. Only we tell the patient to avoid outside colored, orange, Chinese food, which have got highly colorant, preservatives, dyes, chemical, canned food. These we have to avoid. All your home food, which you have been eating since birth, you can continue to eat. Only the colored foods we tell you to avoid. Colored fruit juices or orange, red, which you get from outs, that you should avoid. But all continue your taking home food. So don't tell the patient to stop eating fish or prawns or this thing. Whatever you're eating since birth, it is safe. You can take it safely. So there's no diet restriction for chronic urticaria.
Right. Parul Shinde is asking, are there different types of urticaria?
Yeah, so the acute urticaria is one, then there is a chronic urticaria, and the third variety is known as indicible or physical urticaria. Like if I scratch here, I'll get hives, that is known as dermographism. Or if I put ice, I'll get hives, that is known as cold urticaria. Or if I go in sun, I get itching, that is known as solar urticaria. Or if I hold some bag for a long time, I'll get itching here, that is pressure urticaria. So these are known as physical or indicible urticaria, and obviously doctors can diagnose them, or your patient can know that if I carry a bag, I get hives, so they need to avoid it. So these are other urticarias which can involve up to 20% of the patients.
Okay, doctor. Doctor, as I can imagine that how much of discomfort, distress, and irritation a patient with urticarial condition goes through. Definitely, that person is under a lot of stress. Many a times, people with urticaria avoid going in, public functions, or they stop socializing because they find many a times themselves in a very embarrassing situation because they are continuously itching themselves. Now, is this stress going to aggravate their urticarial condition?
Yeah, anxiety or depression can worsen urticaria, and long-standing urticaria patients do get depressed because they don't find a treatment. So obviously, any stress, mental stress can worsen urticaria. So we tell the patient to stay calm, do some yoga, do some exercise, and if they can't have, obviously, sometimes we take a help of a psychiatrist to control his anxiety or depression associated with urticaria.
Right. Ahana Roy is asking, what causes urticaria flare up?
So flare up, we don't, few causes we know. One of the common causes is stress, some colored food items, menstrual cycle, too much of sunlight, too much of exercise, and a infection, viral infection in the body, or a infection in the chest can cause or trigger urticaria. So these flares are known. So these flares can worsen urticaria. So then you need to increase the medications to control the disease.
Okay. Shruti Nigam is here asking, what is your advice for toddlers with urticaria?
So for toddlers and this thing, again, they also can get urticaria. We have got syrups available for them, which are antihistaminics, which are safe, which are non-sedating. So they need to can take these syrups to control the urticaria. And obviously, a basic investigations are required to find out if there's a hidden infection in the body or there is a trigger in the thyroid or anything. So that doctor will find out if there's any trigger in the body.
Okay, doctor, as you said, there is no, dietary precaution for chronic urticaria. No need for dietary precaution for in case of chronic urticaria. But in case of acute urticaria, is there any dietary precautions or do's and don'ts for the patients of
Typically, we tell the
acute
patient to
urticaria?
avoid, yeah, outside orange, red, Chinese colored food because they can trigger. And if you know that prawns is causing you urticaria, avoid it. If you know seafood is giving you trouble, or maybe a wine can give urticaria. So these food, cheese, wine are known to trigger urticaria. So you have to avoid those food which has caused you urticaria, and avoid the highly colored food, street food, where we do not know how well it is prepared. Better to avoid such food.
Mhm. Right, because a lot of chemicals or preservatives may be
Yeah,
used.
yeah.
Okay. Is urticaria contagious, doctor? Because many a times people feel that, especially in case of skin allergies, that they'll get it from somebody
Yeah,
else.
yeah. So remember, urticaria is not contagious. It is not infectious. If I touch urticaria patient, I will not get it. It is your body's own response to various stimulants in the body or outside the body. So all the urticaria patient can stay safely in a family without taking extra care.
Mhm. And is that got anything to do with the genes or is it genetic?
Well, genetics are not much, but obviously few patients like less than 1% will have got some gene which has got trigger. But typically it is gene. It is not a genetic disease like mother has got, so child will get it. It's not like that. But atopic tendency is there. So those who have got atopic tendency, they
Mhm.
can get more and more allergies. It could be a nose allergy, eye allergy, chest allergy, or skin allergy.
Okay. Doctor, in last 2.5 years, we have seen a lot of patients coming up saying that they had hives after, getting COVID. So is there a correlation
Yeah,
between
yeah. In fact,
urticaria and COVID?
right, right. COVID can come as a fever and rash, urticaria. So that's why when they come with the urticaria and fever, we used to think of COVID. So it was there. And a COVID vaccine itself can trigger urticaria. That was also known to cause. So we know this thing, but it can be safely treated and controlled with the medications. But yes, COVID and urticaria, there is a relation.
Okay. I'll pick few more questions from our viewers. So we have Palak Dubey asking, what lab tests are needed for simple chronic urticaria, no fever, no arthritis, and else?
So basic test, what we do is a complete blood count, sugar, thyroid, IgE to find out allergy, and thyroid test and anti-thyroid antibodies. These tests are recommended by most of the guidelines, which will give us a clue what kind of urticaria it is and what is best to treat. So basic 5 to 7 tests are required. We don't need a battery of tests or lots of allergy tests or costly tests. They are not required.
Right. So, and again, your doctor will tell you, what tests you need to do. So don't worry about that. Don't just go and land up in a lab and say that I need these tests done.
Exactly.
So
Yeah.
please go by what your doctor is asking you to do. Aman Roy is asking, sir, I have been prescribed autologous serum therapy for my urticaria. Is it okay?
Yeah, so autologous serum therapy is a poor man's biologic because your blood is giving you trouble. What we do, we collect separate blood and separate serum and inject. It does give relief in 30 to 40% of the patients. So it is one way of therapy and it is cheap, economical, and your dermatologist can give it. Obviously, all patients will not respond, but 30 to 40% patient will respond to it.
Right. Now, many a times it happens, doctor. I'm sure you must have seen, your patients as well, especially in case of chronic urticaria. As they get some relief after the treatment, they'll stop it without consulting the doctor. And again, when they'll have the similar, conditions or symptoms, they'll go buy the medicines from the same prescription, again, not telling anything to the doctor, and start the medication again by themselves. Is it okay to do or it could be harmful?
Please follow. Don't treat the disease until it is gone. It is not easy that urticaria will disappear very fast. So
Hmm.
doctor will slowly titrate the medicine and slowly bring it down. So you don't stop it suddenly. There could be sudden flares. Again, you have to rush to doctor. So we need to give medicines for months to years together to control the disease. So don't be your own doctor and treat it. Tell your doctor and every try to reduce the medicine very gradually.
Right. So please trust your doctor. And that's why we are continuously saying don't do self medication, don't do over the counter medication, go and consult a qualified dermatologist. Junaid is here asking, okay, so she is suffering from chronic urticaria from last 10 years and he is asking for seeking for suggestions.
So see, you have got 10 years of urticaria, you need to consider dermatologist. A basic investigation has to be done. And if antihistaminics are not working, a biologic known as omalizumab will work for you, or a cyclosporin, doctor will decide. But the 10 years of urticaria, you need to take medication continuously. Don't expect it to get cured very fast.
Right. So please don't waste any more time. Go and consult a dermatologist, Junaid, and you'll definitely get relief. Doctor, one more thing, as from our viewers' questions, we can also make out. Now, normally what we do when we have anything, especially related with our skin, we'll do some home remedies. That's the first thing that comes to our mind. Or we'll go over the counter, ask a chemist for some medication and try to fix the condition. We land up in front of a doctor only when it gets really delayed or it's continuously worsening. What's your advice on that?
Yeah. So see, remember, you can go to chemist and get a calamine lotion to apply, or ice to apply to reduce the itching, and antihistaminics which are available. Like fexofenadine or bilastine, which are safe, you can take it. If they do not show response, please go to doctor, do some investigation, and do the testing.
Right. Priyanka is asking, will my chronic idiopathic urticaria ever go away?
Yeah, it does go away in 5 to 10 years on an average, but some patients will have up to 20 years. So I can't tell you when will it go away, but you take medicine till it goes away.
Right. So you need to continue the medication, Priyanka. And I'm sure, doctor, patients do get relief, right? At least they get relief from the continuous itching or how it is hampering their, living or standard of living. At least that much relief they'll get from the medication.
Yeah, medicine does work. It is not that medicine do not work. Obviously, you have to take it for a long time. So don't think that medicines are useless. They does work wonders, and they do give control of the disease.
Now, in the initial introduction, I said that urticaria is quite common, and almost all of us, or many of us, do encounter urticaria at one point of time. Now, doctor, is it equally common in kids or toddlers?
Yeah, it is common in children also, but it is more common in adults. Obviously, more common in females and more common in middle age. But obviously, anybody can get urticaria right from birth till the old age.
Mm-hmm. And okay, so as a parent, also we need to keep an eye, and in case we see our kids having urticaria, we need to take them to the doctor.
Right.
Right. And again, in case of acute urticaria, many times people say that, with the change of weather or when they are in extreme heat or extreme cold or in the water for many, hours or something, they get these hives. So again, is it urticaria?
Yeah, again, your doctor need to decide whether it's a change of weather can cause you, but obviously you can get it anytime during the day, or change of season may worsen to some extent some patient, but obviously you need to find it out, diagnose, and sometimes biopsy is required.
Okay. Sudeep Sharma is here and is asking, does vitamin D help urticaria?
Well, if you got a deficiency of vitamin D, take vitamin D, but don't that vitamin D does not cure urticaria. But if you got deficient, please take vitamin D. That's all. But it's not a cure for urticaria.
Right. Trupti is here asking, I have urticaria. It's about 6 weeks that I have it. I was relieved from it, but suddenly it appeared again. So please, I want to know that am I getting cured or not?
No. You need to continue urticaria medicine till it goes. It might take few to several months. So obviously you don't stop it suddenly. Slowly reduce it. Obviously, doctor will tell you how to reduce it.
Okay, so again, Tripti, you need to go and consult your doctor. And doctor, many times, in case of acute urticaria, again, people have this problem and they don't land up in front of the doctor, and they try to fix it through some home remedies. They apply aloe vera gel, which is very commonly used these days in almost everybody's face. So they'll just take out the gel, apply it on their urticarial, rashes, or do some other kind of home remedies. What's your take on these home remedies, doctor?
Yeah, so home remedy does reduce itching. So you can apply ice, you can apply calamine lotion, you can apply some soothing lotions to control the itching. But obviously, you need to take some oral medication also, and none of these home remedies will control the disease.
Okay. Now I have Neha Verma with me, and her query is really long. Okay, so it's Palak from Coimbatore, and her weight is 100 kgs and 160 centimeter of height. No blood pressure, no blood sugar. I don't have any underlying condition except urticaria and dermatographis. My body starts itching within 20 minutes after food, especially my foot and palm is itching a lot. So I take allergy tablet after taking Allegra, she is saying, and my itching settles down. Also, I would like to inform you that I had cold in last 10 days. I surprisingly found that even after taking food, I'm not getting these itchings. So the
Yeah,
long
so
and short of it,
yeah, your problem is you, Palak, you have a problem that you have got allergy. You have need to take medicine. Obviously, when you take cold medicine, it has got also anti-allergics that can control your hives. But you need to take long-term medication and you have to investigate yourself why you are getting it. So obviously, a dermatologist will be the right person to tell you because treatment is long. Don't expect it to go away so fast.
right. So, Palak, please go and consult a qualified dermatologist. Now, a lot of time we, keep on wasting our times in over-the-counter medication or home remedies or consulting or going by what the online influencers are telling us. But please save your energy, please save your money, please save yourself and go and consult the right person, which is a qualified dermatologist in this case. Now, doctor, when a patient comes to you with urticaria, does by just looking at them or their conditions, you can make out that yeah, it is urticaria and what should be the
No, no, it
line
is
of.
a skill. There are more than 3,000 skin diseases. So doctor has to find it out with the lens, do some basic tests, do some test and find out whether it's a really urticaria or urticaria vasculitis or something else. So obviously the expertise required and sometimes we do test even a skin biopsy to confirm the diagnosis. So obviously it's a lot of expertise which are required. Just you say it's hives, but it may not be hives, it may be something else. So obviously few tests are required.
Okay, and as we're talking during our session about those allergies tests that people, many a times just go by themselves and get it done. Because again, people are so aware these days, they'll just go to the lab, get those allergy tests, which are really expensive without even consulting a doctor that they need it or not. And then go to the doctor and show that, see, I'm allergic to, say, 30 food items. What should I do? And many people start practicing. They'll omit those 30 things from their plate. Please advise on that.
Yeah. So please don't go for the allergy test. It does not give you clue. It just shows that your body is sensitized. Even if you stop that 30 items, your urticaria will not go. So we don't advise this food prick test or allergy test. It is not to be done in chronic urticaria patients.
Mhm. And doctor, what are the most common mistakes that people with urticarial conditions normally omit? I'm sure one thing is definitely going to the doctor really late, but there are other things that you normally see and say that, oh, you should not have done this.
See, basically, you go to right doctor, take the treatment. Don't take steroids. Don't take medications which are dangerous. And obviously, treatment is in the antihistamines. So obviously, you need to go to doctor and take the treatment and take it till it goes away. It might take months and years together.
Okay. Shubham Maran is here asking, hi, I'm Shubham from Bhopal. I'm 27 years old. I recently moved to another place for work and developed this urticarial condition. The local doctor here prescribed me Etchmite cream. Can I use it for one time?
Yeah, see, that is a scabies treatment. So please confirm whether you have got scabies or urticaria and take treatment appropriately. I cannot really advise about it.
Mhm. So you need to go and consult a qualified dermatologist, Shubham, and get it checked thoroughly what problem you are having. And Dr. Any advice for our viewers?
Yeah, so just last few things before we close down. This is more for the Urticaria Day celebrated on 1st of October all over the world to raise the awareness of urticaria, tell us the right treatment, and this time theme is better quality of life. So you have got a good medicine available to control the disease, but obviously that expertise is required and go to a right doctor and take the treatment and take the treatment till it goes. And obviously it's a long journey and you have to take the treatment till it goes. Thank you very much
Right.
from my side.
So you really need to have a lot of patience because the treatment can be really lengthy. It may take a lot of time. So just be patient and take the treatment. Don't stop it without consulting your doctor.
Yes.
Again, as you said, the improving quality of life is the motto this year or the theme of Urticarial Day. And the thing is that people keep on suffering in silence. They won't come up many a times. They won't talk about it with their family members or friends or go and seek advice from a doctor until it becomes really out of control. So, before we sum up the whole session, doctor, would you like to address those who are still suffering in silence and not coming up?
So remember, if you have itching, please go to doctor. It could be itching due to urticaria. It could be something else like a scabies or fungal infection. So don't hide the disease, because by hiding a disease, it will not disappear. Take the treatment and take it till it goes. And obviously, we have got the best medicines available in India, which are not very costly, and your doctor will be able to tell you. So don't hide the disease. Take the treatment till it goes. Thank you.
And one last question from a viewer, Priya Bedi. Please kindly suggest treatment for urticaria. Allopathy medicines used 2 days, but itching starts at night, generally in the whole body.
So you need to increase the medication of anti-allergic. So if you have got more itching, you take more medicines. So and previously antihistaminics in 2 or 4 times the dose sometimes you are needed, and sometimes you need something extra along with it, like H2 antihistaminics or some other medications. So obviously doctor will tell you, but if they are not sufficient, obviously you need to go to higher medications, and sometimes even the injectables. Thank you.
Thank you so much, Dr. Kiran Godse, for your valuable time, sir. It was a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they now know that instead of self-medication or over-the-counter medication or home remedies, it's always better to approach a nearby qualified dermatologist. It was great to hear you, and we really look forward for many more such sessions in coming times with you for our
Thank
viewers.
you and bye bye.
Thank you, sir. Goodbye. And viewers, thank you for your participation in today's session. And to get the latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead. Goodbye.